Dr. David Schiller here, and today we're going to get to the bottom of why you're not getting the appropriate results from your thyroid treatment. What is it about what you're doing that is not helping you ultimately? So we want to try to, in this very short video format, usually this could take an hour to explain, but I'm going to try to just very quickly summarize why you're not getting results and what you can do about it. It's not a matter of just looking at TSH and T4. There's so much complexity of what the thyroid affects, but also there's effects within the body that can affect the thyroid. So these causes and effects can go back and forth. So just know the thyroid can cause these other things, and these other things can cause the thyroid to malfunction. So for many people, they're not getting evaluated appropriately. They're telling their doctors they have certain symptoms, they check these markers right here, and they say, okay, you have low thyroid, here's a hormone to replace it. But that only works in a very small percentage of the people. There's 6 major patterns, and low thyroid, by simply taking a hormone to fix it, is just one of those patterns. And for many of you, 80% of the people that are doing that, they're not getting better, and they're banging their head against the wall. So just know these are 2 out of 10 markers. So not only do we want to evaluate the thyroid completely by adding in the other markers that we feel clinically would be necessary to come up with a clinical evaluation, but just know that we need to look at these other systems that we're about to talk about as well. So we have the brain sitting up in the head, which does affect the thyroid through that TSH hormone. The thyroid makes 2 hormones called T4 and T3. Majority of what is made is T4, the rest is T3. 93%, only 7%, but T3 is what is active, so that T4 needs to be converted into T3. It's done in the liver. It's done in your gut. The conversion of T4 to T3 in the liver and gut can be affected by cortisol or inflammation, which is produced in the adrenal glands. Liver is the hub of your digestion. What if the liver is toxic? That can affect how that gets converted. In the gut, many of you have probably been undiagnosed with Hashimoto's or autoimmune reactivity of your thyroid, which is what the majority of people with low thyroid have. It's done by a simple marker called a TPO or TG antibody of the thyroid. If it's been checked already and you've been told you're okay, I would still check it again, because many of you you don't have enough oomph in your immune system to even produce an antibody, so it may be coming back falsely negative. So I would get it rechecked again. So we have the liver that helps to convert to T4 to T3, 60%. T4 is converted to T3 in the gut, about 20%. The gut is affected and has the majority of the immune system in it. So if you're eating foods that you're sensitive to, or you've had old infections, or you don't have enough of good bacteria because you've been on antibiotics, you can change the environment of that gut where it doesn't convert. You can change the environment of that gut where now it's inflamed, and now there's reactions into the brain. So there's a gut-brain axis, a interplay between your brain and your gut. When there's inflammation in the gut, that can produce the brain fog that you're having. The inflammation that's produced by old infections or old injuries or foods you're not supposed to eat, the inflammation itself is the biggest cause of why you don't convert T4 to T3. So if the adrenals are affected, maybe you have a lot of stress in your life, that can produce the insomnia. Maybe if you have too much inflammation for too long of a time, your adrenals start getting tired, and now you can't get rid of pains and aches, and that's what can cause problems as well. So the cortisol can shut off thyroid function. The thyroid, the adrenals, the liver, and the pancreas are what help you balance your blood sugar. Blood sugar and blood sugar problems, prediabetes, diabetes, insulin resistance, metabolic syndrome, whatever you want to talk about, blood sugar imbalances, which is controlled by the liver, controlled by the adrenal glands, controlled by your pancreas, controlled by the thyroid. Blood sugar is the biggest mimicker of low thyroid syndromes. So you may have appropriate looking levels of these because they're being balanced by your hormones, but you still have an underlying blood sugar issue that can affect everything and mimic your thyroid issues. Blood sugar that's out of balance, that will affect brain function as well. The brain affects the gut, all these things. The brain is the master controller, so it's controlling all these things. So if it is now inflamed, and if you don't take care of what is called leaky brain, where you've lost the blood-brain integrity because of the gut barriers as well get destroyed. In other words, you get leaky gut. The inflammation and interplay between the gut and the brain can cause the brain fog, can cause an insomnia further, can cause early dementias and memory issues. Just know once the brain gets affected, it affects all these things. So the thyroid can be affected by liver toxicity. The thyroid can be affected by the gut not working well. The thyroid can be affected by the inflammation produced from food sensitivities or an adrenal gland that's failing, or because the blood sugar is out of balance because you're eating foods that you're sensitive to, you're eating too many carbohydrates. Why is the blood sugar affected? So it always goes back to, okay, you're having, we find the interplay between all these things, but what is it that's causing that? So in a functional medicine approach, we look at each individual and what's going on with them. We'll look at 15 pages of history on you. We'll look at what has been done in the past. We'll look at what labs have been done. We'll look at certain things that evaluate each of these systems. So we can take the blood work that will help us evaluate these systems. We'll take questionnaires that help evaluate these systems, and we put them together to figure out, okay, what may be the priority? Because remember at the beginning I said you can have thyroid issues affecting all these organs, because the thyroid can affect everything. Could be why you have high cholesterol, for instance. But you could have high cholesterol because you have a blood sugar imbalance. But also know that these systems can affect how the thyroid functions. For women who take birth control, or women who are on hormone replacement, that can affect the transporters that carry around these hormones to the different parts of the body. Those things are called TBGs, another one of the markers that we can look at. So if you're a woman who has menopausal, perimenopausal, had menstrual irregularities, or if you're a male with a thyroid issue who has testosterone issues, most of the time those things come back to blood sugar as well. So just know that you can have interplays between adrenal glands and thyroid and blood sugar, thyroid and liver, gut and brain, brain to thyroid. All these things are interplaying with each other, and that's what you have to figure out. That's how you get better. So I hope this clears things up for you. I hope this information was not too fast, but just know that you can look for, or you can ask for us to send you a complete webinar on this information. It takes about 45 minutes to go over everything that we just talked about. But just know that this is available to you, and you need to find a doctor who understands the interplay of how these organ systems affect the thyroid, how the thyroid affects these organs, the complete picture of thyroid function, 10 markers, not just 2. And you can look at other posts that I have to help you explain all these different things. Posts that talk about food sensitivities and why gluten is important in your thyroid. And eliminating it most likely is a key. But not just gluten, but other foods. Just know there's lots of stuff to go over. I hope this information was helpful, and make it a great day.